Hello, everyone, and welcome to today's webinar, Meaningful Connections, Engaging Your Patients with Your Patient Communications Platform. I am Terry Messier, Client Marketing Manager here at Medfusion. We are happy to have you join us to hear from industry expert Elizabeth Woodcock. Sean Cheriker, Medfusion's Marketing Director, will also join us briefly to speak on how Medfusion's platform of solutions can specifically assist you in engaging your patients. First, I want to go over a few housekeeping items before Elizabeth begins. Should you have any questions throughout the presentation, please use the chat box to type them in. We will take time at the end of the presentation to have Elizabeth or Sean answer your questions. Please note you can earn CEU credits for attending this webinar. The instructions for how to obtain your CEU certificates are included in the handout section of GoToWebinar. It is located right above the chat box, which is what you'll use to put your questions in. If you have any issues with getting that downloaded, please reach out to me directly at terry.messier@medfusion.com. The session is being recorded, and I will also include the CEU instructions when I send you the link later on this week. Without further ado, it gives me great pleasure to introduce Elizabeth Woodcock. She has a breadth of experience in the patient engagement field to share with you. She's not only an accomplished presenter, she's also a successful business owner and an author. Take it away, Elizabeth.
Thank you so much, Terry. It is such a pleasure to be here today to talk to y'all about meaningful connections, engaging patients with your patient communications platform. I want to say a special thank you to Medfusion for sponsoring our webinar today. And most of all, thanks to all of y'all for joining us to be able to talk about this important topic. Why it's so important? Well, that's indeed how we'll start off with our agenda, really diving into what those changing expectations are. Then we'll spend some time with really understanding where we are today, our status update, our state of the industry, if you will. And then we want to prioritize our digital experience. But first, we need to even understand what that is. Then we'll hone in on our patient portal and how can that enhance our digital experience. And I'll just leave a few brief words in conclusion and then turn it over to Sean from Medfusion, who will be sharing more ideas and insights with us. Well, let's go ahead and get started. Framing our discussion is this topic of patient engagement. And I think there's a lot to this term, so let's unpack it. It means really focusing on patient satisfaction, but also on patient compliance. And it's been really interesting to see, even in the last 6 to 12 months, the major focus that we have today on social determinants of health. I think that's something that us within healthcare organizations and particularly medical practices have been saying for a long time. Hey guys, this is not just about us. We have to think about the patient's social needs. We have to think about their economic, their language, etc. And so patient engagement allows us to break all of that and really recognize the important factors that go into making sure that patients are compliant with their health care. Of course, so in order for us as healthcare organizations to have a healthy bottom line, we have to engage our customers. That's an absolute baseline for success. And really, it's also taking a look at what are we doing? What are those outcomes that we're producing with patient satisfaction and loyalty, with compliance, and of course, with profitability, and making sure that our practice is indeed there to serve our community for many years to come. And last but not least, I would suggest to you, as we'll talk about in this webinar, that patient engagement can indeed lead to efficiency. Convince you why. So patient engagement. Now, if we'd had this dialogue 20 years ago, it would have looked much different. Indeed, when I first started working in practice management, our orthopedics clinic at the practice that I worked with, indeed had 2 appointment times. We scheduled 60 patients for 9 a.m. and another 60 patients for 1 p.m. Why is that? Well, it was the most efficient. Our surgeons simply, in their outpatient clinic, which they thought of just simply a stepping stone to move on to the operating room, wouldn't tolerate late patients, no-shows, or cancellations. So we just scheduled a whole heck of a lot of patients twice a day, and they saw them until they finished. Wow. Think about the expectations today and what would happen if we had that scheduling system in our practice right now. Our patient and family experience would indeed be a little bit troublesome, and it's likely we wouldn't be in business much longer. But it really does speak to the fact that all of these dialogues that we're having now about scheduling practices, communications, we're kind of scratching our head saying, hasn't this always been an issue from a practice operations perspective? And our reality is that it may not have. And that's because our patients' expectations, our customers' expectations have changed, and they've changed a lot over time. Today, our patients walk around with a computer in their pocket. How could it not change, I might ask you? And so, indeed, we've seen some significant changes in that computer in our pocket. I was a little depressed when I pulled these statistics, thinking about my own children as well as myself, although I don't think I fall into this category of spending 5 hours a day on average in the United States on our smartphones. Again, it just when these data roll over you, you realize how we have to change as a business, as a service provider, because our customers indeed are different than they were even 10 years ago. So what do those customers want? I love this survey looking at really what our customers are telling us. And I think this is really important for us when we think about our meaningful connections, is to not only understand what we think our customers want, but to really let the voice of the customer speak for us. And indeed, our patients they want to make an appointment online. I do. I don't know about y'all, but gosh, just last week, I was in class because I'm going back to graduate school, and there I was. I had about 6 minutes between lectures, and I was trying to make an appointment. And oh my gosh, I called my doctor's office. 2 minutes later, I finally got somebody. She explained to me that my doctor couldn't see me until November, and I'm not kidding you, but maybe I would want to see a nurse practitioner. But we hemmed and hawed over that, and then she had to pull up a different schedule. Well, believe you me, that 6 minutes went fast, and you know what I had to do? Hang up without an appointment. The convenience of making an appointment online, the convenience of making sure that we're all prepped and ready to go by completing all of our registration forms online, the convenience of paying for our bills online, and last but not least, being able to communicate electronically. This is the world that we live in. And so if we think as healthcare organizations that we can talk about patient engagement without a digital strategy, I think we're absolutely foolish. And so we really have to think about this desire to improve health, to improve wellness, but also recognize the underpinning of convenience. The underpinning of convenience. Now, I would argue that this also has to do not only with that computer in our pocket, but what other dynamics are going on? We know, of course, that our patients are aging and that we have generations which are changing, not only in our patient base, but also in our employee base as well. And those expectations are getting higher as the generations are getting younger. So our millennials, our Gen X's, and maybe actually they have a good reason to do so. 10 years ago when you walked into a doctor's office, maybe you were I forgot my wallet. I mean, it doesn't really matter because they're not even going to ask me. Or if they did ask you, you would always say, well, just send me a bill. And it really didn't matter. But today's patients, when you and I walk into a doctor's office, wow. I mean, we're going to be lucky to get out of there for $250. Lucky. If I have tests, etc., we're looking at another $400, $500, $600 on top of that. So we have to respect the fact that we have different generations. generations, and they are changing in terms of their expectation based on who they are, generations they represent. And layered on top of that is a significant financial responsibility that we now have placed in the hands of our patients. And these are very important phenomena to realize as it relates to really trying to create, foster, and nurture those meaningful connections. So, how can we make this a win-win? How can this not be another MIPS or some other government program that you have to say, "Oh my God, I gotta sit down Thursday and I gotta figure out how this whole thing works." And it really, really is simply a burden. How can we create a win-win? Well, I love to embrace the fact that all of this convenience that we just talked about, driven by this computer in our pocket that we spend 5 hours a day looking at, driven by really, really needing in this absolute crazy, crazy world that we live in, needing that convenience, literally out of necessity. And then, of course, thinking about those expectations changing, whether it's by generation or by financial criteria. Patients love the convenience of self-service. They want to interact with us electronically, and they desire transparency. So how can we harness these to our advantage? Well, I love the idea of using a free employee. I don't know about y'all, but if I sat down with you and said, "Oh my gosh, why don't we think about FTEs from the perspective of having a free one over here?" And you might be like, "Oh, okay, I'm in. Let's get that free employee." And then secondarily, really focusing on efficiency by reducing synchronous communication. Well, let's really take an optic into looking at that free employee. And I'm just going to go very basic, very basic. When you have a patient who calls you, let's think about this. We take 30 to 90 seconds simply to identify the caller. Okay, I mean, we haven't even done anything. All we are doing is just identifying who is calling. And that's really important to us, right? I was at a practice just 2 weeks ago, and they had a patient, or in this the caller, trying to figure out what was going on with the patient at their practice. Had he been transferred to the hospital? And it was very important for this practice to identify the caller because we didn't want to divulge any information, right? So this identification is important, but it takes time. Good 30, 60, 90 seconds, depending on how many variables you confirm. And then, oh my gosh, and I got to tell you, this is actually somebody's fairly efficient to take a message. Another 90 to 180 seconds. So we are looking at a good 4, maybe 5 minutes simply to have a transaction that if we actually put that burden, if we put that task, that responsibility into our patient's hand, we could get it for free. We could get it completely for free. Now, this happens in our environment all around us, right? I just went out to lunch before our webinar today. I went to a place that has a salad bar. They said, "Oh, Miss Woodcock, go ahead and sit down." And then they said, "Yeah, go, feel free. Get your salad, get your lunch whenever you want to." I am the waitress. I was my own waitress today. And somehow, not only did I pay this restaurant, but I also left a tip. Hello. So the free employee concept is nothing new, but it's something in healthcare I'm not sure we recognize how important it is, because even though we're talking about seconds here, the average physician receives 100 phone calls per day. So absolutely, this is important to recognize. 100 phone calls a day, so 100 times 5. Now I'm talking about chipping away at some time. Speaking of phones, what we rely on as our communication platform today, it requires synchronous communication. Now, this is a fancy term for conveying that you and I have to be on the line at the same time. And I don't know about y'all, but If you've ever worked at a practice which has just opened its doors, it's it's just really exciting because, maybe the first day you have two patients, you're like, woohoo, this is awesome. So the phone rings and you're like, oh my God, let me get the phone. This is great. And you're spending 2, 3, 4, 5. You could spend 15 minutes on that call, right? Because there's nothing else to do. You don't care about this whole synchronous communication. But oh my gosh, when you're in a mature practice and you've got a zillion things going on, you would give an arm and a leg to not have that caller on hold. And the reason is efficiency comes from actually having asynchronous communication. In a busy practice, we're going to see a patient, put a patient in a room, have that injection and come out, and then be able in small batches to take care of those communications instead of having a patient on hold for 33 and a half minutes, waiting for you to finish another task. So this can be a real win-win. And so where are we? Where are we? We've got all of this narrative around us, changing expectations, computer in our pockets, convenience, and something that I would argue we can harness. Are we doing a good job with this? You may have seen just recently the Office of the National Coordinator for Healthcare Technology, which issues these data briefs, just published the uses of an online medical record. Now, I would like to clarify that the terminology online medical record is online access to your medical records by a healthcare provider. So I believe that that is really any way where patient is being offered the opportunity to communicate and or push or pull information with us. So those convenience functions, how many of us have a refill of medication? We can, it's up to 39%. How many of us allow secure messaging? 53%. I don't know about y'all, but when I think about what our customers want and the status update, we've got a fairly large gap here that we really need to think about filling. Another survey here from the College of Healthcare Information Management Executives, really thinking about what are those convenience capabilities that we offer through the patient portal. And some of them we're fairly good at, like test results, for example, as you can see. But some of them we've got to get better. So this is a kind of a good list for us to start off with and really think about which ones of these within our own healthcare organization do we do today and which ones might we have an opportunity to do in the future. And it's important to recognize, and I certainly concur with the researchers, great. It is fabulous to offer these capabilities. But to be honest, it's only half of the solution. We've got to make sure that we don't just have the capacity to have patients utilize a function, but we also need to make sure that they actually use it. And so not only looking at adoption, but also usage of your patient communication platform. This is something that I'm seeing high-performing healthcare organizations focus on. They're not just looking at how many registrations, for example, do they have in terms of their portal signups, but they're also looking at how many users do they have per month and whether or not that usage rate is growing. So you may want to consider adding those two data points onto your key performance indicators. Why? Well, there is indeed a compelling reason for us to address this because not only is the world changing around us, but our customers have told us, you know what, we're actually going to change. We're going to go to a different physician if you're not able to offer that service or convenience. So as we think about ourselves, and we may be averse to change, but as we look out at our competitive landscape, if our competitors are offering this service, this convenience, then we're going to see that business loss And oh my gosh, there's nothing as depressing as seeing a practice that has softening volumes that is desperately trying to figure out what's happening. Because by the time you see those volumes softening, unfortunately in healthcare, it's too late because our patients have already left us. One of the things that you may want to consider as a good signal for what may be an opportunity is indeed to take a look at chart transfers. And of course, this can be made electronically or on paper, but chart transfers to another physician of your same specialty within your community. Because what that is signaling is the patient has left you. The patient's left the house, and it might be a good idea for you to reach out to them and figure out, hey, can you tell us a little bit about what we could have done to serve you better? Again, letting the voice of the customer really speak through. So our focus today on PX, which of course is an acronym that's being used for patient experience, having a CXO, a Chief Experience Officer, and really focusing on that patient experience from all angles. And embedded within that strategy is our digital experience. And when we think about our digital experience historically, it has really been on the phones. I don't know how many of you have experienced this problem, but I've worked with practices that are like, well, we can't pick up the phone. We don't have enough staff to do it. So all of our patients are coming in to talk to us, right? Because they can't communicate with us any other way than the phone, and we're not picking up the phone. For goodness sakes, y'all, the industry average for abandonment rate, 10%. I'm not kidding, 10%. So patients start flooding in. They can't get through on the phones and they're going to come talk to you. We cannot tolerate this any longer. We have to think about our digital experience as really an omni-channel patient communication platform. It's not only our website. It's not only what's happening on our cell phones. It is indeed how we're texting our patients, which if you aren't already doing, it's something I would strongly encourage you to do because we're really seeing a lot of research around the really looking at what's happening when patients are in your practice. And let's hone in on how a patient portal may be a huge success to really create and extend that patient communication platform so it syncs up with what is really a digital experience. You'll be proud of off that loyalty so that we're not seeing our patients run off to our competition. I think it starts off with simplicity. And I love to start off talking about, indeed, this picture of the United States post office mailboxes. And I love the post office. But oh my gosh, really? Are we out of our minds? This is part of our omni-channel patient communication platform. We still send out letters. Nobody opens them. I don't know why we're still doing it. People, our patients, are wallpapering the walls of their kitchens with them. This is not an effective strategy. And yet we seem to be obsessed with it. So how can we, again, really focusing on convenience, but also efficiency for us, that win-win. So how can we really look at our communication strategy to support our practice as well as our desire to have convenience rolled out for our patients? I think it starts off with online bill payment, being able to allow our patients to pay online. More and more patients want the convenience. Nobody has checkbooks anymore. If they do, they can't find them because they never use them. And then, of course, furthermore, the credit cards have us so locked up that we want the points from our credit cards. And so we're going to pay by credit card unless you're able to wrangle that checkbook out of our hands. Convenience, convenience, convenience. And oh boy, we've got this great opportunity for us to actually get paid. But let's don't stop there, because I think one of the problems with patient portals really was meaningful use. And I know you're like, what? Why are you introducing that? Well, let's think back to 2011 when the American Recovery and Reinvestment Act was put out. And then we had this launching of this EHR incentive payment program. And with it became meaningfully using our electronic health record system, right? That was the congressional term that was built into the bill. And so the Centers for Medicare and Medicaid Services went ahead and converted to meaningful use. And one of the big issues that we had to comply with in meaningful use, of course, was a patient portal. But from that to get-go, we were just obsessed. Let's get as many patients packed onto this registration system as we possibly can. We'll throw up a few functions. But gosh, y'all, I'm not sure if we ever really sat down and said, this is more than just a transaction. Let's think about how we can actually use this as a tool, as a resource. Now, today, when we look at 2019, and I know we're not meaningfully using, but now we're not just advancing care information, but oh my gosh, we're promoting interoperability. But sit back and don't just look at the checklist related to the merit-based incentive payment system and promoting interoperability. Look beyond the transaction. What can we do? How can we focus on payment plan administration? I mean, this is a huge area just right here. Y'all know that the majority of payment plans that medical practices set up, we actually lose money on. And the reason we do is they're like $5 a month, and it takes an exhaustive amount of resources for us to administer them. So again, moving beyond the transaction and seeing how can we solve the other challenges that we have in our practice. What about all those calls that we get from patients who say, you know what, can I have statements from the past 6 months because I need to turn them in for my HSA plan? How can we make this a win-win? I really think that our patient communication platform is just one of those untapped resources, and we sort of just put it to the side. Oh, check the box. We got the meaningful use. We got the promoting interoperability. And now it's time to turn around and say, how can we marry this awesome platform with our patients' expectations for convenience today to really create those meaningful connections? So let's look at scheduling. We just saw the data that really proves, you just heard my own personal story. I know all of y'all have one as well, how important scheduling is. And I think we have to be careful because, like you, I have my internist's cell phone number because, I know him professionally as well as personally. And then, of course, he's my doctor. And he always says, oh, Elizabeth, just call me, just text me. Oh, no, I'm not going to use the black market. That's what I call it, the black market for access to doctor's offices, for scheduling. And y'all, all of us are in the black market because we're in the industry. You got cell phones for the doctors, right? You can text them. You can get through all of that 6-minute phone call. But we got to step back and make sure we take off our rose-colored glasses and we really understand that voice of the customer who's frustrated because they can't make an appointment. So what do we need to do? Let's think about this in 3 layers. The very basic is, let's at least have the ability to request an appointment online. This doesn't really create a lot of efficiency, but it does capture new business. Now, this is, again, very basic. You have some little form, the patient, when they're on your website, they go ahead and complete, but then you call them the next day or that day, maybe within the hour or 2, to actually make the schedule. Baby steps. Okay, well, let's think about our established patients. Maybe they could book their own appointments, particularly if we have a specialty like, for example, physical therapy, allergy, where there are routine appointments for established patients that need to be made. And then, goodness gracious, wow, We know that this is a huge convenience, but I got to tell you, the real value proposition from self-scheduling has nothing to do with the convenience factor. And it has everything to do with the fact that you will cut, mark my words, you will cut your no-show rate in half. And this is really an impactful statement. Let's think about this. How come we are allowed to cut our no-show rate in half? Well, the reason is that indeed we are not offering that convenience for our patients. We're not offering that convenience, so we're scheduling patients. One of my absolute worst practices, and I still see it all the time, is auto booking. Y'all, I just saw it just 2 weeks ago, where the patient is scheduled or referred to, for example, general surgery for an appointment, right? So, I go to general surgery. And indeed, what is crazy is we just call, we just book that appointment on their behalf. The general surgeon office says, oh yeah, next Monday at 9 a.m. And then we call and leave a message for the patient. You're booked for an appointment next Monday at 9 a.m. with the general surgeon. I mean, come on, y'all. Literally. How can we even believe that that would work? And the reason we believe that that would work is we've tasked that employee with the referral and to schedule an appointment. And so, by God, she got it done. She got it done. It's not going to work, but she got it done. So really thinking about how to turn these transactions into values. And that's a great example of it. And what about just putting it out there, having new patients book their own appointments? And I know this is a little scary, but I'm telling you, it's a step we've got to take. I know that in 20 years, we'll be talking about this webinar today, and we'll be saying to ourselves, oh my God, do you remember when we were talking about actually calling to schedule an appointment? Do you remember when we were like, oh my gosh, really patients scheduling their own appointments? That's crazy. Because 20 years from now, this will indeed be the norm, or we will have leapfrogged something way beyond this. Our patients indeed want this. They need this. There's a lot of other value related to scheduling, including being able to implement our confirmations, thinking about rescheduling, because that's super duper important when a patient has to cancel their appointment. We really want to capture their business. Of course, we could go off and talk a lot about leakage, but this is a key area for leakage. You got the patient. They had the appointment. Now, what happened to them? You need to bring them back to avoid that leakage to your competitor. Really thinking about our follow-up to missed appointments. Goodness gracious, we had an appointment on the books. This is a patient's care. How can we use our communication platform to make sure they get the wellness, the health care they need? Making sure that we recognize the importance of communicating with our patients during any sort of office closures. This in and of itself is a huge opportunity to use our patient communication platform, if for nothing else, just this. Now, indeed, really that value proposition related to scheduling, cutting those no-shows down, really looking at our reschedules, filling that unused capacity. Remembering this important mantra that we cannot outperform our schedule. So we want to make sure we use our communication platform, whether we're given 20 slots or 2,000 for that day. How can we perform all the way up to capacity? How can we optimize that capacity we've been given to make sure that we do the best job we can for the community of patients we serve? So lots of other opportunities before a patient walks in the door on a pre-arrival basis so our patients can complete their paperwork or maybe even submit this. And oh my gosh, what if we didn't have to pay registered nurses to key in vitals? Y'all, talk about the discussion related to working at the top of our license. This right here, value proposition written all over it. Today, we are paying registered nurses to be keyers. They are taking patients' vitals and they are keying data into our system. It also leaves the door open for an incredible amount of mistakes. So, how can we actually have, for example, the patient's social history that they've given us flow right into our system? And wow, maybe even our patients could arrive themselves all together, printing off their boarding passes and coming right on in. Now, I'm not suggesting that we're going to be in a position to eliminate all of our staff on the front end because those team members play an important role, but there are opportunities to accommodate, particularly patients in our younger generations who are looking for that convenience. They're looking to bypass any sort of lines that you would put up and really thinking about how we can make this pre arrival really more convenient, but also save us some time and money as well. So, clinical messaging is another area we saw on our list that patients really crave. And the biggest barrier I find to this is ourselves. And so, just to think about how we really focus on convincing our clinical team that messaging makes a lot of sense, recognizing that it is and ensuring them that it's a secure platform, that we have that incredible value of patients identifying themselves and documenting their own question. So those are two items that free employee can really give us. We don't have this phone tag anymore. And when you sit down with medical assistants and nurses, this is absolutely at the top of the list of frustration. And that whole conversation we discussed about synchronous versus asynchronous, we can actually get work done in small batches. So with clinical messaging. Now our patients can document the answer and have that. This cuts down on the additional number of phone calls. And as we'll discuss in just a few minutes, I think it's an important understanding for us to have that when we give patients information, it often gets transferred to multiple other parties, spouses, children, parents, grandparents. And so that's also going to cut down on misunderstandings as well as extra work for us, flowing right into our EHR system, and importantly, allowing you as practice executives to really think about how this platform can help you hold your team members accountable for the work you're expecting to be done. Now, we made note of the fact a few minutes ago that test results is indeed one of the key areas for our portal. But before we do, how do we even get patients to think about clinical messaging? I like to use some sort of script like this. Oh, Miss Woodcock, sure, happy to take a message. Absolutely. But I got to tell you, you're going to get a faster response if you message Trisha. You'll get a faster response if you use the portal to communicate with the nurse. Now, please make sure that if you say you will do this, you've got to make sure that you do. And one of the things I talked about accountability, but another tip is to use the sunset rule, where every day before sunset, whether you close at 4:35, 5:30, or 6, you're making sure that all of your messages have been responded to. And importantly, I didn't say answered. I simply mean a response was provided, and it may be, thank you so much for your communication. We're working on an answer, and we'll absolutely get back to you tomorrow. The sunset rule. Now, we know, as I introduced before, that test results really is an important capability and function for our patient communication platform. It's simply not good enough for us to say, if you don't hear from us, everything will be just fine. And I think it's a great idea for us to have even like kind of little old school 3x5 cards or something where you've printed up that gives patients the information when they have a test about where to get the results. This is going to be the number one driver for the utilization of the portal. And once you get on there, then of course you can introduce the patient to all the other wonderful functions that you have that really foster caring and convenient connections. Now, this is a great opportunity for us to talk about not just these transactions today, and hopefully I pushed the envelope a little bit, but what will our communication platform do for us tomorrow? It will allow us to really be able to delve into this world of preventive maintenance. So when we, for example, see that our patient's test result has A1C over XYZ, maybe it's 8, 8.5, that we actually have preventive maintenance come in and alert that indicates, all right, it's time to come in, or it's time to go ahead and schedule. Don't call us, schedule your next appointment. We also recognize the critical nature of this aging patient population, our baby boomers, and how can we let our communication platform not only serve our patient, but their caregivers. And this is something that genre of customers, right? It's not just our patients, but it's all of the wonderful family members and community members that are helping to take care of that patient. How can they use our platform to really be able to communicate with us and to figure out how to create some efficiency on our end as well. We also know, and I briefly mentioned this idea of social determinants of health, it's all the other factors that go into really creating a patient's health. We are able to have the influence on healthcare, but what about the patient's food and environment and education, et cetera? And while you may say, oh, well, I mean, that's something that's kind of pie in the sky and out there in the future, just a couple weeks ago in Congress on bicameral support was introduced the Understand Act that indeed is utilizing national data, effectively reforming standards and tools to address negative determinants of health. If passed into law, this would require healthcare providers to submit Z codes on all Medicare and Medicaid patients. So this is a real game changer, and I think will really, really engage our practices and healthcare organizations into this topic of social determinant of health. So whether it's transactional, whether it's a value, we know that the time is now. The time is now to create the foundation for caring and coordinated connections so that we can have that meaningful connection to our patients and to our practice. Well, thank you so much for the opportunity to be able to present. And I'd like to go ahead and turn the podium over to Sean. He will give us a view of the challenges he sees in the healthcare market and discuss how Medfusion is positioned to address these challenges head on. Sean?
Thank you, Elizabeth. Great insights as always. Okay, let's start with a few things that can be frustrating for your patients. The patient experience can't just mean a patient portal. The patient experience should be the holistic experience that engages the patient from before their appointment, like scheduling an appointment, filling out forms, and making payments from any web-enabled device of their choice, to follow-up visits and even patient experience surveys. These are huge time savers for the patient and the staff. Ever since our inception close to 20 years ago, our portal hasn't required the PIN or token process. We find these processes to be roadblocks for many of our clients. We want to make it as easy as possible for the patients to engage with their practice. Our goal is to drive workflows to the portal from the patient's web-enabled device to pay their bill, reschedule or confirm appointments, and make any changes to their portal account. As Elizabeth pointed out, cell phone use is prevalent throughout the world, and this is the primary mode of communication for most Americans. Enabling patients to use their mobile portal to message doctors eliminates phone tag, increases patient satisfaction, and most importantly, it streamlines the practice operations. While you don't need to eliminate voice calls completely, mobile messaging platforms have been proven to be a very successful way to communicate and improve care compliance, which ultimately results in better health outcomes. The goal is to have the patient buy into their own health care, which will make them healthier and more satisfied with their provider. Don't just think mobile usage is for younger generations. Studies have shown that mobile response rates in patients 60 and older are very similar to that of patients between 15 and 59. As we all know, technology is changing the ways consumers and businesses act throughout all industries. Consumers expect to have 24/7 access to your practice to conduct tasks on the go through the channel that's easiest for them. It's time for healthcare industry to catch up. The future of patient interactions is not by phone, at least not the way medical practices are used to. By utilizing the latest technology available, you'll not only provide patients with better experience to earn their loyalty, but you'll also save your practice valuable time and money. On the right side of the screen are some of the different solutions within our portal that patients can engage on their devices. Online self-scheduling gives the patients the ability to schedule their appointment based on the rules the practices create 24/7, basically extending the time the practice is open. Patients can also send secure messages to the practice to ask about upcoming appointments, check prescriptions, and ask pretty much anything the patient needs to know, which reinforces the sticky long-term relationships. Patients can also easily refill prescriptions and view their prescription history. Online bill pay is extremely important, giving the patients easy access to make a payment. We aim to make the payment process frictionless. And possibly the most important to the patient, the portal gives them access to their medical records, empowering the patient. We believe these powerful applications within the portal is providers' foundation to success. The whole point of these powerful patient engagement solutions is to help automate the patient experience for both the patient and provider. And one way we can help do this is to reduce cost volume. The patient has the ability to make an appointment or make a payment online. This helps reduce the cost and frees up employees to handle more patient-centric tasks. It's a great way to increase revenue. If a new patient is comparing providers' websites and they notice your website has online self-scheduling and bill pay, this is a huge differentiator for your practice and can definitely help capture new patients. Overall, with patient self-scheduling, it helps maximize the scheduling openings and closes gaps in your schedule so providers can be more efficient throughout their day. What we're really doing here is putting the patient to work, having them fill out their forms online before their visit, having them schedule their appointments, having them make their payments. These tasks are all standard in other consumer-focused industries. Overall, delighting the patient with powerful, easy-to-use patient engagement tools that keeps them happy and keeps them loyal to the practice. Case in point, this is a great success story. Karen Clark, the CIO at Ortho Tennessee, a practice with 60 physicians, was having a difficult time with their existing portal from a competitor. That portal is clunky and difficult for patients to use, so she made a decision to move to the Medfusion portal. In less than 4 months, they had more than 10,000 patients successfully transitioned to the new portal. Also, using online bill pay, they've actually quadrupled the amount of payments they were previously receiving from their patients. They found that the Medfusion payment application was easy for their patients to use, reducing AR days and increasing their bottom line. So lastly, I wanted to quickly cover our security certifications. We can all see the healthcare security breaches that occur within our industry almost on a daily basis. This is why Medfusion upholds strict security policies to ensure the confidentiality, integrity, and availability of sensitive patient information. We are HIPAA compliant, and we've also earned the 3 most prestigious security certifications in the healthcare industry: PCI DSS Level 1, ONC Certified HIT, and most recently HITRUST, where we've certified for all of our solutions: Patient Portal, Patient Self-Scheduling, Medfusion Pay, Medfusion Plus, and their supporting infrastructures. HITRUST is the most frequently updated security framework in use today, with quarterly updates and annual audit changes. So we're continuing to invest our platform and ensure that we are the best of breed. With that, I'm going to turn it over to Terry, and she'll moderate the Q&A portion of the session.
Thanks so much, Sean and Elizabeth. Great job. Lots of great information there. And just to repeat, I will be sending these slides out at the end of the week. I have a couple questions that came in from the audience. One of them is, I believe, directed to Elizabeth. What is the actual purpose of the Understand Act?
So the purpose of the Understand Act, and again, it is just an act, so this is not something that has been signed into law. And if it were, it would probably be a good 6 to 12 months before we would have to comply with it on an administrative claims basis. But essentially what it is getting into the heart of social determinants of health, which is how did the patient have this healthcare event or chronic illness? And indeed, it's not only that the patient, for example, might have had hypertension today, also the fact that he or she may not have been able to afford the medications that we gave him last time, and that's why he's in a hypertensive state today. So these additional codes that CMS is requesting, Z codes, I like to think of them as the external codes. There are these other factors that are going on to really have promoted why the patient was there today. And again, it's kind of rounding out the patient's healthcare. So that's a little bit about the Understand Act. So it'll be really interesting to see if that moves forward. And if we do need to comply with those, we're going to have a lot of coding changes in the next 6 to 12 months if it passes into law. Terry?
Excellent. And actually, someone did say, what are Z codes? So you pretty much gave that answer already. And then someone said or asked, I can understand doing that in a family practice, but what about a specialty practice?
Yeah, so actually social determinants of health are really applicable to all different types of practices. I mean, again, I know I'm naming scenarios, but thinking about a post-operative wound, if the patient didn't have access to proper materials in terms of covering that wound or did not have access to clean water. Again, I actually think it is something, as I mentioned during the webinar, that medical practices should absolutely embrace, because right now it's, why is a patient back, right? You didn't do a good job. You're the doctor. The wound is still open. And so this is really allowing us to round out the patient's story. Now, I'm not in any way suggesting that sometimes none of this stuff is our fault, but again, it's adding to the narrative, giving us a lens of really the patient's full health. So it is absolutely applicable to all specialties. Now, I'm sure there's going to be circumstances where we can't find a code, but it'll be interesting to see if that law passes and what we need to do to comply. Terry?
Yeah, so they asked additionally regarding Z codes, I think they're wanting to know if there's any specific special guidelines for preventative services.
Well, definitely there are, and what I would say is the best, because there's 70,000 plus ICD-10 codes. I would definitely, do a search. There's some wonderful coding organizations, AHIMA and the AAPC, on Z codes, and just keep the ear to the ground as to whether or not that act. Again, it was bicameral support, which of course means both the Democrats and the Republicans supported it. So that gives it at least a fighting chance for passing into law, but I would at least start poking around with some of those resources through AHIMA and the AAPC to really understand how Z codes work. Great time to do that. Terry?
Okay, I believe the next question would probably be addressed to Sean. Any suggestions on how to sell this type of service, which I'm assuming the question is referring to the portal. Any idea how to sell the service to physicians when it doesn't make any money in the doctor's eyes? Doesn't make any money for their practice?
Sure. So, Elizabeth can kind of chime in on the MU2 and MU3, but, I think it's important for our clients or their patients to know, to have access to their own information. It's important for the practice to be able to offer them access to be able to pay their bills, make schedules, and for them to keep control of that particular all those data points for their patients. And plus, it helps. It really helps the provider out as well.
Yeah, and if I could just piggyback on that, Sean, I really want to emphasize that. And I also want to, hopefully we've kind of sprinkled throughout this presentation real value for the practice from an efficiency perspective, and to emphasize that this really is going to be a business necessity to offer some of these convenience factors to our patients. We saw from that survey that 83% of their patients said that they would switch providers based off of service and convenience. And we would never have heard that in the past. And so it's really a business necessity. One of the fun things I've done to this practices question, which may be a little bit rogue, but I think it's a really neat idea, is if you have a patient leave on your P&L, like your profit and loss statement, have a line, and obviously it's a sort of funny money, but have a line as to what that patient would have represented in revenue. And it's just a way to monetize patient loyalty loss to physicians who are like, oh, it doesn't really matter. I've got plenty of patients. Put some numbers to them. So, if you have a new patient and that might have been 2 or 3 visits or 2 or 3 surgeries, just, attribute some revenue to that and put that on your financial statement. It is definitely a game changer when the physician sees, what's this $10,000 down here? Oh, well, you know what, ma'am, sir, those are patients who left. So just another kind of almost silly idea, but one that can be very impactful to really convince physicians that this is the direction you need to head in. Terry?
Yeah, okay, I know we're getting to the top of the hour here. We have some great questions. Let's see, do we interface with all EMR systems? I believe you mean does Medfusion interface with all EMR systems? Sean?
Yeah, we're EMR agnostic. There are certain channels that we really specialize in, but if whoever asked the question, we can certainly get back to them and kind of walk through what that process looks like.
Excellent. And then someone makes a good point that they agree collecting payments online can increase merchant services by 1 to 1.5%, which is significant, but do we have any strategies around this?
Yeah, so our merchant services is, a lot of folks look at merchant services and say, oh, that's a commodity item, everybody has the same thing, but we do something a little bit different. We have special reporting that is easy for the providers to understand. They can reconcile easily from that reporting, which is kind of differentiates us from the competition. And if you don't have the payment processing platform today integrated into your website or into your front office system, it's a game changer. It really will bring more revenue in, and it'll bring it in faster.
Excellent. Okay. Well, we do have a couple of the questions that I will actually address to the person who asked directly after the webinar, and we are at the top of the hour, so I want to thank everybody for joining us, and thank you again, Elizabeth and Sean, for some great information and wonderful presentation. This presentation was recorded. Along with the slides and the audio will be sent to you by the end of the week by me. I will also include the CEU handout, but again, you can download it in the handout section of GoToWebinar right now today if you would like to do that. Thank you for joining us, everybody. Have a great day.